Sounds good. All right. Thank you so much for the opportunity to present. Um, so throughout the presentation, please feel free to ask any questions or use the chat function. Maybe for the sake of the presentation, we'll kind of save the questions to the end, but I'll keep an eye on the chat box if there's any immediate questions I need to address throughout the presentation. And to help increase engagement and interaction, I want to hear from you. So feel free to type into the chat box what your favorite mobile app is that you use in clinical practice. And then I'm also curious to hear what your favorite non-medical mobile app is. And we can take a look at the end and see kind of what some favorite apps are. So today we're going to be talking about the impact of antimicrobial stewardship mobile apps on prescribing practices. And my contact information, my email is down there if you have any questions down the road. So I have two major objectives for today's presentation. We're going to discuss the impact of mobile app technology on antimicrobial stewardship. And then we're going to present some study findings regarding the impact of mobile app technology on antimicrobial stewardship here in Saskatchewan, and some success stories regarding Spectrum in Saskatchewan. So I don't have any disclosures. Okay, so let's start. In the current landscape, in the last decade, the number of healthcare-related smartphone apps has grown exponentially. And mobile health technology apps offer a practical way to increase both accessibility and navigability of medical information during routine provision of patient care by healthcare professionals. We already know that the vast majority of healthcare workers and especially physicians are carrying smartphones. Upwards of 85% of physicians use smartphones, and I would venture to guess that that number is even higher now. And a significant proportion of healthcare workers are using mobile medical apps in their clinical practice. There's data that suggests even healthcare workers who are older, 80% of physicians aged 55 and older do own a smartphone. So I think there's a huge opportunity here to take advantage of smartphone apps to improve knowledge translation. And there's a huge opportunity here for innovation, especially when it comes to antimicrobial stewardship and knowledge translation. So medical apps can be a huge opportunity for medical education and clinical decision support tools. And we can use apps to disseminate information regarding protocols, guidelines, and local antibiogram data, and facilitate reference and information gathering as well. Antimicrobial stewardship mobile apps can also improve clinical decision making at the point of care, so right at the bedside, and also improve adherence to guidelines and improve patient outcomes. Mobile apps also have the advantage of being able to update them in real time, thus eliminating this concept of muda, or the Japanese term for waste, ensuring that guidelines are up to date rather than relying upon reference handbooks or pre-printed order sets. When we look at attitudes towards antimicrobial stewardship and antimicrobial stewardship smartphone apps, we know that smartphone apps are definitely used more frequently than pocket guides. Clinicians are likely to be in close contact with their phones, in contrast to pocket guides, desktop computers, or reference handbooks, which may be harder to access while on the wards. And we also know that junior doctors in particular are more open to technology and use stewardship apps more frequently. We also can see that high app usage is associated with improved awareness of the importance of antimicrobial stewardship, and it also empowers junior doctors to challenge inappropriate prescribing when they see this observed in other physicians and their colleagues. There's no concerns regarding app use with respect to patient concerns and accessing phones during ward rounds or accessing the app at the patient's bedside. I find as long as your patient is aware of what you're doing on your phone to optimize their care, they're usually on board with it. So there's definitely advantages and some disadvantages of antimicrobial stewardship mobile app platforms. So here are some advantages. We know that clinical decision support tools are readily available and easily accessible. We can expand content to cover a greater depth and scope, and then also include real-time updates if guidelines change based upon changes in resistance patterns, for example. We can also obtain quite a bit of metrics and data regarding utilization of stewardship apps and the impact on prescribing practices. There's huge opportunities for QI and content expansion and PDSA cycles to tailor content and expand content based upon what clinicians want to see. We can also integrate local guidelines and local antibiogram data into the apps themselves, as well as integration of calculators or clinical decision support tools to integrate and adopt into practice. Usually, mobile app platforms are free for the user, but not always. And it's possible that the development of the app and support might be provided by the app developer, but again, not necessarily all the time. There are some disadvantages that are potential and important to consider. For example, not all clinicians may be carrying a device, and so you may want to have different options, whether it's a web-based platform, to ensure that all healthcare providers are able to access information. You may have a culture of early adopters of new technology. There may be some people who are resistant to using mobile app technology into clinical practice. There may be cost associated with integration of an antimicrobial stewardship mobile app, whether it's a cost that's direct to the user or an overall subscription cost to the healthcare team. There may be issues in terms of technical expertise and maintaining the database. And it may not necessarily be useful if you can't tailor it on a local level and integrate local antibiogram data. When we look at some of the pre-existing literature and data regarding some barriers to using antimicrobial stewardship mobile apps, clinicians definitely agree that mobile apps can enhance patient care and are one of the best ways to access hospital guidelines. But they do want to ensure that some barriers or potential barriers are addressed when implementing new technology. For example, concerns regarding usability, cost of the data is kept updated in real time, and then of course the complexity or navigability of the app itself. There's data regarding what clinicians actually desire and what is important to them when it comes to a mobile app that's healthcare related, and specifically for an antimicrobial stewardship mobile app. The top three things that clinicians desire are drug dosing information with respect to antimicrobials, and then local treatment protocols recommended for a variety of infectious disease syndromes, as well as integration of their local hospital antibiogram data into the app. In addition, clinicians want something that's modern, simple in visual design, the ability to search by categories, and a well-organized menu of options once they open the app. Clinicians also desire built-in tools, for example, drug dosing, calculating renal function or EGFR, and automatic updating of the app, and of course, navigation should be intuitive and fluid. When we look at the impact of antimicrobial stewardship mobile apps, there are a few studies that I want to share with you today. In general, mobile devices have been shown to improve clinical decision-making and increase efficiency in terms of work practices. And antimicrobial stewardship programs can also harness the utility and ubiquity of smartphone apps as well. And certainly a well-designed app can increase awareness of stewardship and can potentially influence prescribing behaviors. So through thoughtful design and implementation, we can provide cutting-edge clinical recommendations directly to the fingertips of prescribers. So prior studies have shown that antimicrobial stewardship mobile apps are associated with increased adherence to local guidelines and policies, decreased use of broad spectrum antimicrobials, as well as increased susceptibility to antimicrobial agents, and as well cost savings. So this is the first study that I want to share with you. This was a quasi-experimental design that was done out of West London, UK, through one of their antimicrobial stewardship mobile apps called iApp, or their Imperial Antibiotic Prescribing Policy app. And this was a quasi-experimental design with an interrupted time series analysis, where they assessed the impact of this mobile app on prescribing patterns using biannual point prevalence surveys of medical and surgical wards over a 6-year period. And they launched this app in August 2011. So what they found is they saw a significant increase in compliance with policy on surgical wards, not necessarily on their medicine wards where they already saw high rates of compliance and adherence with local policy, but specifically on their surgical wards, they saw a significant increase in compliance with local treatment guidelines and recommendations. They also saw an increase in the percentage of prescriptions with a stop or review date being documented in the patient's orders, both on medicine and on surgery, that you can see in both these figures here. So again, maybe more of an appreciation for recommended durations of therapy and overall appreciation for the importance and value of antimicrobial stewardship and setting stop dates, review dates to optimize the duration of antimicrobials being prescribed for patients. The second study that I want to share with you was done out of Brazil. And this was a longitudinal study that looked at antimicrobial usage 12 months before and after implementation of their local antimicrobial stewardship app. And this app provided guidance to reduce inappropriate use of particularly broad spectrum antimicrobials, including carbapenem usage that they identified as an issue in their center. So this was done out of Brazil, and during the 1-year study period, they had over 1,700 downloads of their app. And they also were able to time how long people were spending in the app itself during the session. And 50% of those sessions were less than 1 minute in duration. And through this study, they found significant reductions in the use of both piperacillin tazobactam and meropenem through implementation of a stewardship app. Now, what's interesting is that if you look at their if you look at these graphs, what's important to note is that the usage of meropenem may have already been decreasing before implementation of the stewardship app. But certainly with the graph on the right, I think we can appreciate how the significant trend and decreased usage of piperacillin tazobactam and the shift that's identified in that interrupted time series analysis. So they also ended up increasing susceptibility to carbapenems over time with their antibiograms after implementing this app, which I thought was really interesting, that an app can have such significant value and potential to not only change prescribing patterns, but potentially change resistance patterns as well. And they also found a significant reduction in antibiotic costs of nearly $25,000 US dollars per month. So now I want to shift gears a little bit and move towards talking a little bit about Spectrum that we implemented here in Saskatchewan, and show you some data and information regarding the utility of Spectrum in particular. So when we look at Saskatchewan, we know that Saskatchewan is the second highest user of antibiotics in Canada, and we do have limited antimicrobial stewardship resources across Saskatchewan, and especially a huge need for local guidelines tailored to our susceptibility patterns, and need for effective knowledge translation tools and clinical decision support tools we can provide to frontline prescribers to assist them in making the right choices when it comes to antimicrobial prescribing practices. So when Justin and I first were starting here in Saskatoon, we really wanted to create an app and implement an app to help frontline prescribers with their antimicrobial decision making. And so we received a College of Medicine Research Award through the University of Saskatchewan College of Medicine to implement Spectrum to start off with in Saskatoon. And this was in April of 2018, where we launched Spectrum in our center. So through Spectrum, clinicians are able to access over 20 local clinical guidelines and pathways, local antibiogram data and resistance patterns that we keep updated based upon new antibiogram data on an annual basis. And then local antimicrobial formulary and dosing information is all integrated into the app as well. You initially open, you have access, and again, it's free to download, free to use. You have access to clinical guidelines, pathogen information, and antimicrobials as well. So in the clinical pathway section, we developed content that is adherent with current evidence-based guidelines and recommendations, but then also tailored on a local level based upon our antibiogram data. You can also integrate different calculators. So for example, for community-acquired pneumonia, integration of a CURB-65 scoring tool to help tailor antimicrobial recommendations. In the pathogen section, we have some of the most commonly identified pathogens with local resistance data, recommendations regarding infection control policy. And then in our antimicrobial section, we have information regarding risk of C. difficile infection, bioavailability, dosing based upon renal or hepatic impairment, side effects, adverse effects associated with those antimicrobials, general susceptibility patterns, and then linkage to our local susceptibility patterns through our antibiogram data as well. So it's a pretty sleek design and pretty easy to create information and cross-link in the app itself. So that way users can navigate the app easily and then also search for the content that they desire. As I mentioned, you can integrate different risk calculators, for example, a CURB-65 score or a PIT bacteremia score to help clinicians make the best choice for their antibiotics based upon susceptibility patterns. This is another example of a scoring tool that you can implement in the app itself. And then through in the section regarding antimicrobials, again, you have information regarding common usage, drug monitoring, interactions, pharmacokinetics, and dosing information as well to help educate prescribers. For different bacteria, you can also integrate information regarding what type of personal protective equipment is important to don and doff during those situations. So that can also be easily integrated into the app. This is an example of the guideline for community-acquired pneumonia for the integration of the CURB-65 score, and then information regarding empiric therapy and what to do in the setting of a penicillin allergy, for example, with cross-linking to different antimicrobials and penicillin allergy assessments as well. And again, with different pathogens, we can link it to our antibiogram data. So that way users know rates of susceptibility for different bacteria. And we can also integrate our antibiograms based upon whether our antibiograms are specific to ICU, hospital medical wards, outpatients, urine versus non-urine isolates. All of that antibiogram data can be integrated into the app to help our clinicians access this information. So with respect to antimicrobials, these can be localized based upon your formulary and information regarding cost, bioavailability, as well as risk of C. difficile infection. Information regarding nomograms and dosing for Banco and aminoglycosides is also integrated into the app with dosing information. And we can also identify which agents are restricted to infectious diseases. For example, in Saskatoon, carbapenems are on restriction as an example. We can also provide clinicians with real-time updates. So there's an opportunity for notifications. So say, for example, we had new antibiograms uploaded or a drug shortage. We can provide clinicians with those real-time notifications as well. We also can do different fun little notifications during Antimicrobial Awareness Week, for example. This past year, we disseminated information regarding COVID-19, as well as tips and tools on prescribing practices, and then also had some fun quizzes that we could link in the app itself regarding antibiotic personality quizzes as well. And recently, what many centers have done is implement COVID-19 guidelines to help disseminate information regarding COVID-19, rates of concomitant bacterial infections, recommendations for antimicrobials if there is a concern for a secondary bacterial infection, and also the utility of novel therapeutics for COVID-19 and what their different centers recommend, or potentially what trials are available in their center. So looking at data, as I mentioned, there's lots of data that we can track and obtain with antimicrobial stewardship mobile apps. This is an example of data coming out of CHIO, so the Children's Hospital of Eastern Ontario, as well as Alberta Health Services in Calgary, regarding the number of active users and rapid early adoption with launching of Spectrum in their respective centers. We can also track information regarding who is using the app and accessing the app. So based upon their care profession, when you initially download Spectrum in your center, there may be an initial survey asking you what healthcare provider you are, whether it's a physician, pharmacist, resident, nurse, and that information can help us find out who is using our app and what information they're accessing as well. There's also opportunities to do surveys in the app itself to ensure quality improvement and continuously enhance the app itself. So this is just an example of a survey. I think this one was done out of Calgary, but just regarding some benefits of implementing a stewardship app. This data comes out of Calgary in Alberta Health Services after they implemented Spectrum, particularly in their intensive care units. And they did an interrupted time series analysis looking at the usage of anti-pseudomonal agents before and after implementation of Spectrum. And they saw a trend towards decreased usage in their center. And what was interesting is that over time, they saw an increased use in narrow spectrum antimicrobials and decreased use of broad spectrum antimicrobials, leading to an overall cost savings of nearly $500,000. This data comes out of Markham Stouffville and relates in particular to their community-acquired pneumonia guideline, and they were recommending to their clinicians to decrease usage of macrolides for unnecessary atypical coverage, especially for outpatient prescribing practices and patients with a low CURB 65 score. And through their data, they were able to see a significant reduction in both intravenous and oral prescribing patterns of azithromycin following implementation of Spectrum. These are the number of sites that are now collaborating with Spectrum to give you a sense of their expansion over time. And so this morning I was just kind of reflecting on some of our milestones here. So in April of 2018, we launched Spectrum here in Saskatoon. And then through some of our success stories and data that I'll show later on, to successfully implement Spectrum for all of Saskatchewan and all integrated service areas through collaboration with different champions throughout the province. And we launched Spectrum for all of Saskatchewan in March of 2020. And then we also launched Spectrum for Mom and Kids Health Saskatchewan through the Jim Pattison Children's Hospital, and our pediatric antimicrobial stewardship champions launched their version of Spectrum in July of 2020 as well. So lots of things to celebrate. Okay, so let me show you now some of the local data that we've garnered through the implementation of Spectrum here in Saskatoon. So we initially launched Spectrum in April of 2018. This graph on the left in the blue line gives you a sense of the number of unique monthly active users. And an active user here is defined as someone who has accessed the app for at least 45 seconds, or I think it's at least 30 seconds during a session, and accessed at least once in the past 30 days. So that number sometimes fluctuates between 800 active users. And in the red line, that data shows you for an active user, the number of times that they were accessing the app on in a day. And so that is usually somewhere between 1 and 2 sessions per day. The average session length was 2 minutes and 34 seconds. So when someone accesses the app and is in the app, they're spending an average of 2 minutes and 34 seconds. And at least gives you a sense of how much time they're spending to access information. And hopefully they're able to rapidly access the information that they desire. This graph on the left gives you a sense over time of the number of active users in Saskatchewan that were using the Saskatoon version of Spectrum. So we saw widespread adoption both in Saskatoon and Regina and many other centers, community centers throughout the province. It was also interesting to see that people in Alberta and Manitoba were using our version of Spectrum, which just might reflect curiosity, or in Manitoba not having access to Spectrum in that province, they might be looking at the Saskatoon version. Again, given Spectrum is free to download and use, if you were to download the app right now, you can access guidelines and look at what other centers are providing through Spectrum across the world. We can also get information regarding the types of healthcare providers that are using our app. So for example, when Saskatoon, the were pharmacists, physicians, residents, fellows through that initial survey when you download the app. So the vast majority of our users were pharmacists, physicians, and residents. We can also track what guidelines, pathogens, and antimicrobials are most commonly being accessed. So this certainly would fluctuate over time. And this is a snapshot in January of 2019, where the most commonly accessed guidelines were reflective of community-acquired infections, specifically community-acquired pneumonia, non-purulent cellulitis, and urinary tract infection. And the most commonly accessed pathogens were reflective here, group A strep, Enterococcus faecalis, and MRSA. And the most common antimicrobials were amoxiclav, Cipro, and ceftriaxone. But again, this information is likely to fluctuate over time based upon secular trends. So after we launched Spectrum, 10 months following the launch of Spectrum, we wanted to do a survey to get information regarding user satisfaction. And we found a really high response rate of 182. And we surveyed people or informed people about the survey both through SHA emails and through the Spectrum app itself. So the majority of our survey respondents were reflective of our end users, physicians, pharmacists, and residents. In the survey, we asked people how often they access Spectrum and how often they prescribe antimicrobials. These are pretty consistent, so accessing Spectrum usually most frequently once a week, and prescribing antimicrobials on a weekly basis as well. So those kind of matched up a little bit there. And then with respect to the survey content, so again, using a 5-point Likert scale, we asked people whether they thought Spectrum was easy to navigate, whether it saved them time, whether they thought it was useful, whether the content was relevant to their patient population, and whether it increased their awareness of antimicrobial stewardship, improved the appropriateness of their prescribing, and whether they would recommend it to other healthcare professionals. And the response was quite positive, and self-reported changes in prescribing patterns. So then we took it one step further and wanted to look at specifically on our medical wards where we saw high adoption of Spectrum. We wanted to look at the impact of Spectrum both on total antimicrobial usage, which is in the blue line, as well as anti-pseudomonal antimicrobial usage, which is in the green line, before and after implementation of Spectrum. And what we found was that we saw a 25% reduction in total antimicrobial usage, as well as a 33% reduction in anti-pseudomonal antimicrobial usage after the implementation of Spectrum. So this is a slide that I made today based upon the number of active users amongst the different SHA integrated service areas in Saskatchewan. And so I think it's just important to take an opportunity, especially during these challenging times, to celebrate some of our success stories here. And I definitely want to acknowledge the work of our antimicrobial stewardship pharmacist and Justin Kozar for the incredible work that he's done with respect to Spectrum. And I also want to acknowledge all of our collaborators and champions for antimicrobial stewardship throughout the province that have played a pivotal role in informing clinicians of Spectrum in their centers and promoting its use and helping us to evolve and expand content. And I also want to acknowledge our senior leadership for their support of this tool and in ensuring funding is available on an ongoing basis to ensure that clinicians have ongoing access to Spectrum. In general, I think this slide shows, again, a lot of success and high adoption rates and sustained usage of Spectrum in different integrated service areas in Saskatchewan. So in conclusion, I think we can see that mobile apps are widely used amongst healthcare professionals and can certainly be harnessed as an effective localized stewardship tool in providing clinical decision support. Stewardship mobile apps are dynamic knowledge translation tools that can improve local guideline adherence and optimize prescribing practices. And antimicrobial stewardship apps can certainly be an effective tool in our toolbox of strategies to augment and enhance the effectiveness of our work. So I wanted to, again, thank you for the opportunity to speak today. And my contact information is there, and I'm happy to address any questions at this time.
I guess one of my questions is, and it's actually kind of related to your last slide there too. So what is, I guess from your guys' view, what are some of the best ways that we can encourage clinicians in our areas to download the app and to make use of the app? What kind of stuff have you guys done in Saskatoon, I guess, that you think was successful in getting the high numbers you guys have there?
Sure. So first, let me just acknowledge your incredible board game collection there. That's awesome. Things that we did to optimize uptake of the app in Saskatoon. I think word of mouth is a very powerful strategy. I think we had high uptake, in particular amongst medical students and residents, in terms of junior learners who certainly spread the word to their colleagues. I think simply just strolling down the wards and letting clinicians know of the app can be very effective, and disseminating the word that way. We put up posters kind of near in spots where physicians were likely to kind of sit down with a chart and write a progress note or put in some orders. That way there was a visual cue, a visual stimulus regarding the app. So we just put some posters up around on different medical wards to increase uptake that way. Different things like email, through the SHA email, we could disseminate information that way. But I think word of mouth was honestly one of the best ways, and that's why we saw like rapid adoption and that huge exponential spike when we initially launched Spectrum.
Yeah, that's great. Are you guys are you willing to share copies of like your posters and things like that? Anyone who's interested?
Yeah, for all the champions, for all the Antimicrobial Stewardship champions, we created posters for your specific center, and so I can definitely send those out. Feel free to shoot me an email if you want some of those posters, and then you can print them and put them up around your hospital or your wards. And that might be an effective way to remind people of the app, especially during these challenging times, where we might start to see higher rates of inappropriate prescribing practices.
That's great, thanks. I see Dr. Malin has a question here in the chat. He wants to know if you can tell us a bit more of the local specific content for centers outside of Saskatoon that has been added for expanding the app for provincial use.
Yeah, that's a great question. So I think there's always room for expanding content. So I think in particular, when you're accessing Spectrum for Regina, for example, you have access in that area for Regina-specific antibiograms. So that is the predominant difference when you access Spectrum for Saskatoon versus the Regina area versus the Northeast area. The antibiogram information and susceptibility data is going to be tailored to those centers. I think over time, as our antimicrobial formulary becomes a provincial formulary, that content is likely not going to differ a whole lot, but there might be some differences in terms of what agents are on restriction. And then with respect to guideline data, again, not likely to change a whole lot, but there might be certain infectious syndromes for which there might be varying resistance patterns in different parts of Saskatchewan. So for example, resistance patterns with respect to macrolide resistance and Streptococcus pneumoniae, or resistance patterns regarding specific gram-negative pathogens and hospital-acquired infections, where there might be some trends and differences over time, and that might reflect differences in local guidelines.
All right. Well, thank you very much, Shaquille, and we appreciate all the work you guys have been doing with this app. I think it's a great tool for clinicians. I know it's something that in Regina we're able to connect with all of the new physicians that are hired in the Regina area. And so it's one of the first things on our list is, did you know about this app? And you guys could download that on your phone. So we're trying to get all clinicians as they come into the area to at least be aware of it, even if they're not necessarily using it, but they're made aware. So yeah, it's a great app. And yeah, I think for everyone tuned in here, to take that message and encourage the clinicians in your areas to make use of that. Reach out to Shaquille and Justin if you want to connect with, get any of those resources they've got to help make that happen. So thanks, Shaquille, for your time today, and thanks everyone for joining us.